بسم الله الرحمن الرحيم. هنتكلم النهاردة على diagnosis of pregnancy. قبل ما gestational age is also known as menstrual age. It is calculated from the first day of the last menstrual period, and the duration of the pregnancy is 9 months 7 days or 280 days or 40 weeks. قبل ما نتكلم على how to diagnose pregnancy, we must know the definition of trimester. The pregnancy is divided into 3 trimesters. The first trimester from the beginning of the pregnancy till 12 weeks plus 6 days. Second trimester from the 13 weeks till 28 weeks plus 6 days. And the third trimester started from 29 weeks till 40 weeks plus 6 days. So diagnosis of each trimester differ from the other trimester. In the first trimester, the patient, and we started in any diagnosis, we must depend on symptom, which is what the patient or the client complained, and the signs, and then investigation. In the first trimester, the patient or the pregnant woman will started by complaining of missed period and amenorrhea. Then cessation of the amenorrhea or missed period is a cessation of the menstruation. This is due to increase in estrogen and progesterone produced by the corpus luteum during pregnancy. Sometimes some bleeding may occur at the time of expected menstruation, and this is known as Hartmann sign. And this must be differentiated from attack of threatened abortion. Also, the patient usually complain of morning sickness. This occurs in about 50% or more of the pregnant women, usually appear soon after missed period, and nausea and vomiting, especially occurring in the morning on rising of the bed, and usually disappear by the end of first trimester on in the beginning of the second trimester. The pregnant women also complaining of the frequency of micturition. Frequency of the micturition will occur due to congestion of the bladder mucosa. Also, compression of the urinary bladder by the pregnant uterus, which is increasing in size. Also, due to increase in the glomerular filtration rate and the increase in the formation of the urine. Also, changes in the maternal osmoregulation may lead to increased thirst and polyuria. This frequency of micturition usually disappeared by the end of the first trimester, when the uterus becoming an abdominal organ, so the compression of the urinary bladder will decrease. Also, the pregnant women may complain of certain breast symptoms, as the pregnant women may complain of enlargement of the breast, heaviness of the breast, discomfort, and tingling sensation of the breast. This may occur in about 6 to 8 weeks of gestation, especially in primigravida. Primigravida means the female which is pregnant for the first time. Also, another symptom and common symptom in first trimester is appetite changes. As we say in the lecture of maternal adaptation, we say that there is certain gastrointestinal changes like craving to certain food, also pica, which is craving to certain abnormal material. Sometimes the pregnant women may refuse certain foods. Lastly, the pregnant women usually complain of fatigue and sleepiness and or sometimes tendency to sleep. As regards the signs of the pregnancy, we there are signs in many organs. So in the breast, these signs will appear as early as 6 weeks to 8 weeks of pregnancy. As we said before, that the breast signs usually evident in primigravida, and primigravida means the female which is pregnant for the first time. So when we examine the breast of the pregnant woman, we found that the size of the breast is increased. There is increased vascularity, and so there is dilated visible veins in the breast. Also, we see there is increased pigmentation in the nipple and in the primary areola and in the secondary areola. Also, late in the first trimester, there will appearance of the Montgomery follicle. What are these Montgomery follicle or tubercles? They are dilated sebaceous glands in the areola. In late also first trimester, there is expression and secretion of the colostrum, which is a thick yellowish secretion, not milk, but it is a very essential for the nutrition of the baby in the few days after delivery, because it is rich in immunoglobulin, which give this baby immunity for few months after delivery. Also, when we examine the abdomen of the pregnant woman in the first trimester, usually the uterus is not felt except in the late first trimester till about 12 weeks, when the body or the fundus of the uterus is felt just above the symphysis pubis as a suprapubic bulge. Later on, when we examine the pregnant woman vaginally and by manual examination, there are certain known manifestation or signs. One of them is Jacqueminot signs, and there is also Osiander signs and Gödel signs. What is Jacqueminot sign? It is known also as a Chadwick sign, and it is a dusky hue of the vestibule and the anterior vaginal wall. It is visible about the 8th week of gestation. Also, it is more seen in multipara, and as the pregnancy continue, these Chadwick signs become more evident. Why, or what is the cause of this Chadwick sign? Is due to local vascular congestion. As we know there is increased blood flow to the uterus and to the pelvic area, so this area becoming vascular, and so it appears as a dusky violet appearance. Osiander signs is feeling of the pulsation in the lateral fornices when we do pelvic examination, usually at 8 weeks of gestation or later on. Goodell signs, this when we feel the cervix becomes soft as early as 6 weeks of gestation. This softening, making the feeling of the cervix as feeling the lip. On speculum examination of the cervix, there is bluish discoloration of the cervix, known as Goodell's sign, and also the cause is increased vascularity. When we examine the uterus by per vagina, by manual examination, we found that the size of the uterus is increased. It becomes soft in consistency and globular in shape. We can feel also Hagar signs. Hagar sign can be felt between 6 to 8 weeks of gestation. When we put 2 fingers in the anterior fornix, the fingers of the other hand on the abdomen behind the uterus, the fingers on both hands can be approximated due to marked softening of the lower part of the body of the uterus, as it feels empty, and because the conceptus occupying the upper part of the uterus. Also, there is a palmar sign, which are uterine contraction felt by the fingers in the vagina during bimanual examination. How to diagnose first trimester pregnancy by investigation. Firstly, by immunological test. Immunological tests depend on the presence of the human chorionic gonadotrophin in the blood and then in the urine of the pregnant female. Human chorionic gonadotrophin is detected in the serum of pregnant female in about 5% 8 days after conception, and in 98% by day 11, while the diagnostic level in the urine seen only about 23 to 24 days after conception. Blood tests, there are 4 main types of assays: radioimmunoassay, immunoradiometric assay, ELISA or enzyme-linked immunosorbent assay, and fluoroimmunoassay. Radioimmunoassay is sensitivity up to 5 milli international unit per milliliter. To be completed, it takes 4 hours, and it can be detected at 3 to 4 weeks gestation. Immunoradiometric assay, which is more, there are 2 types. One is more sensitive and one is less sensitive. Which is the more sensitive, becomes sensitive at 150 milli international unit per milliliter. It takes about 30 minutes to be completed, and gestational age when the first positive about 4 weeks. Less sensitive immunoradiometric assay, sensitivity at 1500 milli international unit per milliliter. It complete the time to be completed 2 minutes, and gestational age when first positive about 5 weeks. ELISA, there are also two types, one very sensitive and one less sensitive. The very sensitive become level of sensitivity 25 milli international unit per milliliter. It is completed after 80 minutes, and gestational age when first positive 3.5 weeks. Less sensitive, sensitivity less than 50 milli international unit per milliliter, completed in 5 to 15 minutes, and gestational age when first positive 4 weeks. Fluoroimmunoassay is very highly sensitive at a level of 1 milli international unit per milliliter, but it takes about 2 to 3 hours to be completed, and gestational age when first positive 3.5 weeks. These are all these blood tests used for serum pregnancy test. For the urine, there are old tests as agglutination test, whether slide or tube, but ELISA is used also for urine pregnancy test. The second method for investigation for diagnosis of first trimester pregnancy is ultrasonography. In ultrasonography, the gestational sac can be seen in the decidua as early as 29 to 35 days of gestation. And gestational sac with yolk sac inside can be identified by vaginal ultrasound as early as 5th week of gestation. Fetal pole and with cardiac activity can be identified by vaginal ultrasonography by 6 weeks. Heart sound can be identified by Doppler at 10th weeks. For diagnosis of pregnancy in the second trimester, which means from the 13th weeks of gestation till 28 weeks plus 6 days of gestation, these depend also on symptom, signs, and investigation. Symptom: amenorrhea continue, morning sickness and urinary symptom gradually decrease. The patient may feel quickening, which is perception of the fetal movement for the first time by the pregnant woman. These perceptions differ from primigravida to multipara. Primigravida, as we said, the female pregnant for the first time. So the perception of the first perception of the fetal movement usually by the 18th to 20 weeks of gestation, while in multipara, due to her experience, there is perception earlier by 2 weeks, usually from 16th to 18th weeks of gestation. Also, the pregnant female observes that there is progressive abdominal enlargement. When we examine the pregnant female in the second trimester, and when we inspect the abdomen of a pregnant female, we observe firstly the linea nigra, which is an linear pigmentation extending from the symphysis pubis to the Ziphisternum. It appears or become evident by 20th weeks of gestation. Also, with the observation or inspection of the abdomen, we see what is known as stria gravidarum. Stria gravidarum, two types, stria rubra and stria alba. All striae will start by rubra and then become alba. They are visible in the lower abdomen and more towards the flanks and sometimes in the thigh. These striae are result of the stretching of the skin of the pregnant female. Then when we palpate the abdomen of the pregnant female in the second trimester, we feel the uterus as an abdominal organ, and we can measure the height of the fundus by centimeter, and to measure this height. Also, we can palpate the fundal level by our hand. We define or divide the distance between the symphysis pubis to the umbilicus into three parts. The uterus at 12 weeks is just palpated above the symphysis pubis. The junction between the lower third and the middle third is the 16th weeks. Between the middle third and the upper third is 20 weeks, and then between the middle third and at the level of the umbilicus, it is about 24 weeks, and then above from the umbilicus to the ziphisternum, it will be divided between three parts also: 28 weeks, 32 weeks, and 36 weeks. And then by the age of 40 weeks, the level of the fundus decrease due to engagement of the head to the level of the 32 weeks. Also, when we measure, by the palpation, we feel the fundal of the level just at level 12, then 16th, 20 weeks, 24 weeks, and 28 weeks in the second trimester. Also, we can feel what is known as Braxton Hicks contraction, which are intermittent painless contraction detected by abdominal examination. Also, we can feel what is known as external ballottement, which can be elicited at the 20th weeks of the gestation through abdominal examination. Active fetal movement also can be palpated by the examiner hand at interval. We can auscultate the fetal heart sound by Pennard stethoscope. This can hear the fetal heart rate or phonic souffle and uterine souffle. Fetal heart rate by Pennard stethoscope is heard by at about 20 weeks to 24 weeks gestation. Also, by Pennard, we can hear fetal souffle due to rush of the blood through umbilical artery, while uterine souffle is heard as soft blowing systolic murmur at sides of the uterus, and it is equal to the maternal pulse. Then what investigation can be done in the second trimester for diagnosis? Radiological examination by X-rays. We can see fetal skeleton shadow by about 16 weeks of gestation, but it is not used nowadays. Secondly, ultrasonography. Ultrasonography in the second trimester not only diagnosing the presence of the pregnancy, but give a detailed survey of the fetal anatomy, placental localization, integrity of the cervical canal, also can detect any malformation, and also fetal viability. Diagnosis in the third trimester. As we said before, we start with symptoms. Amenorrhea continue. The enlargement of the abdomen also continue, and this will lead to certain discomfort to the pregnant woman as palpitation and dyspnea. As later on, the patient may or the pregnant woman may feel lightening. This about 38th week of gestation, which is sense relief of the pressure symptom on the stomach and on the heart and on the chest due to engagement of the presenting part. What is meant by engagement is the descending of the lower part of the fetus in the pelvis. Also, frequency of micturition will started again due to pressure of the presenting part on the urinary bladder, and fetal movement become more evident and more pronounced. In the third trimester, signs in the abdomen as pigmentation and striae become more prominent. Also, we palpate the fundal level from 28 weeks to 32 weeks to 36 weeks, and by the age of 40 weeks, the fundal level return again or descend again to the level of the 30 weeks. Palpation of the fetal part become more easy, and also auscultation of the fetal heart sound by Pennard become more evident. Fetal souffle and uterine souffle can be heard. As regards investigations in the third trimester, X-ray can detect fetal skeleton as in the second trimester, but it is not used. Ultrasonography in the third trimester not only diagnosing the presence of the pregnancy, but also assess fetal growth and measure amniotic fluid. If there is oligohydramnios, which means the decreased amount of the amniotic fluid, or polyhydramnios, which is increased amount of the amniotic fluid. Also, the ultrasound will assess the biophysical profile of the fetus, which is the condition of the fetus, if it is at risk or not. Lastly, we must differentiate the pregnancy from other conditions like uterine fibroid, ovarian tumor, tuberculous peritonitis, hematometra, distended urinary bladder, or pseudocyesis.